This is a story about rising up, about how human ambition can overcome the seemingly impossible. Reminding us that anything is possible. For over a decade, I've travelled the world making films with a global health focus.
That's great, looking good.
Imagine the most important woman in your life, how much she means to you. Now imagine her dying from a cancer that is totally preventable. I was filming at an enormous cancer hospital in Sri Lanka. I will never forget the day that changed my perspective on women's health. I remember being in a very crowded hospital ward, which was like nothing I'd ever seen before. There was rows and rows and rows of cot beds. There was fans to move the air around, but the humidity and the heat was quite intense.
We can see that she's really upset and she wants information.
So I remember filming with a woman, she couldn't have been much more than 30 years old, clearly very, very unwell. And I just remember her looking up at the doctors so desperately hoping for information, and the reality of her situation was that she was probably going to die very soon.
The first thing we need to do is get her infection under better control.
Like most women, she's integral to her family. She's a wife and a mother, a breadwinner. It dawned on me that when a woman's life is cut short like this,
And I think our
the knock-on
duty
effects
is we
are
have to-
catastrophic. This is not that story. Believe it or not, this is a positive cancer story. In fact, it's the most extraordinary health story of our time. It's the story of conquering cancer.
We choose to go to the moon in this decade and do the other things, not because they are easy, but because they are hard.
A moonshot is an ambitious, groundbreaking effort with unforeseeable outcomes. It sets out to achieve something that is generally believed to be impossible.
It's one small step for man, one giant leap for mankind.
Geneva, Switzerland is the headquarters of the World Health Organization.
With support from WHO.
A resolution has been made by all countries in the United Nations to eliminate cervical cancer.
Kenyatta.
There are 3 pillars to the elimination strategy: vaccination of girls, cervical screening or testing of women, and treatment for those who need it. And this too is a moonshot.
We have a moral
I'm here to
duty
talk with Dr. Tedros
respond
Adhanom
urgently and
Ghebreyesus,
effectively
the
to
Director
outbreaks
General
and
of the
other
WHO.
emergencies.
All right, so I'll get straight into it if that's okay.
Yeah.
So the WHO has prioritised cervical cancer elimination. What was the tipping point for that decision, that call to action?
The number of cases globally, new cases globally of cervical cancer is more than 570,000. Out of this, more than 300,000 die. And at the same time, we have the weapon to prevent this from happening. We have the vaccine, we have diagnostics, and we have also treatment. And when you have all this, and a woman is dying every 2 minutes, is not acceptable. So that's the tipping point. So people say, no, this is not acceptable and we have to do something.
We're going to travel the globe and discover how the world can rise up to the elimination of cervical cancer and save tens of millions of lives.
But why this matters may be even more profound. Conquering cervical cancer invites us to dare to emerge in a world without cancer.
Cervical cancer is one of the only cancers that we've totally figured out. We know what causes it, we know how to screen for it, we know how to treat pre-invasive disease. So really no woman should be dying of cervical cancer.
Everyone calls it the big C for a reason. It's scary, isn't it? You understand the impact it has on not just the patient, but the family, the loved ones that you leave behind, the pain.
Cancer can be conquered. Cervical cancer particularly can be conquered.
It is amazing to think of a cancer elimination, and particularly in countries like Malaysia, where it's the second and third most common cancer.
Conquering cancer means a world with women who are empowered to do other things, and they're not succumbing to a disease and unable to give their full potential to their families, to this nation.
So what I want to learn now is how it all began. I've come to the University of Queensland to meet with Professor Ian Fraser to uncover the backstory. When Ian Fraser arrived from Scotland as an enthusiastic young doctor, he had no idea that 25 years later, he would be named Australian of the Year. He led a team that developed a vaccine for the virus that causes cervical cancer, which kills 300,000 women annually. Let's go back to the beginning. What is cancer?
Cancer is the abnormal growth of cells in your body, basically. Cells that should stay quiet, grow and divide and spread through your body and cause problems.
And how did the name cancer come about?
In ancient Greece, 2,000 years ago, Hippocrates was the father of modern medicine, and he observed all sorts of illnesses. One of the illnesses he observed was cancer. To him, skin cancer looked like a crab on the skin. So he gave it the name Kantero, which is crab in Greek. And that name has stuck ever since. Do you know what the major predator of crabs are?
No.
Their major predators are octopuses. That's probably a good idea from the octopus's point of view. If you've got 8 legs, you've got a much better chance of getting control of a crab than if you just have 2 arms.
Which is an interesting analogy with the way we're actually tackling cervical cancer.
Yeah, we really need all the tentacles we can get, if you like, to get cervical cancer under control.
I'm in Sydney to learn what it actually means to have cervical cancer and how you get it in the first place. I first met Kirsty a few years ago when she was recovering from her cancer.
Cervical cancer has impacted almost every aspect of my life. My job, my career, my mental health at stages, my marriage. You know, we've got through everything, and I'm very lucky to have everything that I've got today, but it's had an impact on a lot of my life. I almost didn't engage with it for a while because it felt like I couldn't be a cancer patient at 26. I was so young. I was shocked that it was cancer and that I needed treatment and surgery. As someone that was getting regular pap smears and had the vaccine, I was 17 or so when I had the vaccine, and I'd already had a sexual partner by that time. So I did know, and I do know, that it's really important that girls and boys now have it, you know, when they're young, before they do have any sexual partners. Because I had an aggressive form of cervical cancer, I ended up having a few surgeries to remove my cervix, which is the bottom of the uterus, and my lymph nodes. But it was absolutely frightening that the best option at the time was to cut my uterus in half. And it was quite scary as a 26-year-old to have your what felt like your womanhood cut out, and to be told that when I came round, I might be infertile. So that was frightening. It was just surreal to be able to have a baby despite the odds. I think the most important thing is we live in Australia and we are so lucky to be in a country that has vaccines and screening programs, but it's still really important to get screened and to understand what the vaccine does and doesn't cover, and that it has to be given early. So my message is to know if you've been vaccinated, to know if you're due for a test.
Vaccines are the single most effective public health measure that we've had after clean water and good food. This vaccine rates with the poliovirus vaccine in terms of its ability to prevent disease. If we look back at the history of poliovirus, roughly the same number of people used to die of polio every year as currently are dying of cervical cancer.
Africa in the 1980s was awash with polio, but it's now close to being eliminated. Similarly, Africa currently has the highest burden of cervical cancer. Here in Zambia, efforts are underway to put this disease in the history books as well. Unlike the polio vaccine, the HPV vaccine, which prevents cervical cancer, is a fraction of the cost.
Cervical cancer is the most common cancer that we have in Zambia. Most of the women that we are seeing with cancer of the cervix in this country are coming in the age ranges between 30 to 45. That means that women are coming in with cancer of the cervix in the prime of their lives when they are contributing to this nation economically, socially and culturally as well. And when we look at presentation in terms of staging, we still find that women are coming in with advanced disease. We find that over 50% of the cases that they saw, women were coming in with stage 4, which is the last stage of cancer.
Screening and testing women early, before cervical cancer develops in the first place, means that if precancerous lesions are detected, a simple procedure can remove their risk for life.
The Zambia Cervical Cancer Screening Program was started in 2006 with 2 clinics. This program now has close to 160 clinics, and we are seeing close to 300,000 women coming in annually getting their first screen in their lives. When we talk about elimination, we're talking about women living longer. We're talking about women culturally being involved in the lives of their children. As we know in our communities, women are the ones who pass on. They are custodians of history, of culture. Women are the cornerstone of society. So having them in society means that we are continuing development as a nation.
Zambia is a leading light in eliminating cervical cancer in Africa. I still have some unanswered questions about the virus that leads to cervical cancer. So I'm calling on one of the world's leading experts to get some clarity. Thanks for having a chat with me today.
Oh, you're welcome.
I'm really interested to know, what is HPV?
So HPV is the human papillomavirus, and it causes almost all of cervix cancer worldwide.
And how do you get it?
HPV is spread through sexual activity. It's a very common infection. In fact, 80% of us at least will have an HPV infection sometime in our life. But typically we won't know about that because in most cases the body clears the virus naturally and medical intervention isn't needed. It's when a persistent infection is established with one of the types that is capable of causing cancer that we've got a concern.
And so how would you detect that?
The collection of the sample is the same as in the old PAC program. So that involves a pelvic exam with a speculum and a doctor or nurse taking a sample from the cervix. Well, one of the great benefits of the HPV test and one of the really exciting opportunities is that we know now that a sample a woman takes using this small swab from the vagina is as accurate as a sample taken from the cervix in a pelvic exam. That opens up so many opportunities to reach women for whom that exam is a really big barrier. We've used this opportunity not only in Australia, but in a partnership in Malaysia with my colleague Yinling Wu. And we've come up with what we call the ROSE solution. So that's removing obstacles to cervical screening. And that's two parts. That's an HPV test, self-collected, together with a mobile version of our CamScreen digital health solution.
This is important because the largest number of women who die from cervical cancer live in Asia. How the ROSE program, reducing obstacles to cervical screening, is taking shape.
So, jadi hari tu bila mereka ambil pap smear tu, nampak ada sikit sel yang mereka tak
Dr. Yinling Wu is leading the charge in innovative service delivery that overcomes cultural barriers to cervical screening.
Selesa tak? The obstacles are quite well known, and particularly in a developing country. For someone to take time out to go to a clinic when they are well for a screening test, that's unheard of really, particularly in the working class when they're very busy. We don't have an organized screening program whereby women get letters, and so it's really up to their own initiative. And I think most importantly is the fear or the perception of pain and embarrassment when they have a very private test. So a pap smear, a conventional pap smear, requires quite an uncomfortable pelvic examination. The healthcare professional needs to use a speculum to access the cervix in a female. So to remove that aspect of the discomfort, what we've done is we've now used self-sampling. Okay. And this is really through the knowledge sharing by our friends in Australia.
Okay. To open up this tube, you hold it at this red cap here, okay? You twist and you pull, okay? And then you see here this red line? Yeah. Okay, so you put your fingers at the red line, okay? And you insert it until you feel your fingers. Mm-hmm. Okay, once inserted, you have to twist it 5 times like this.
So imagine you've transformed something that's so invasive to a simple test where women can do this test in their own privacy, taking their own time. And if we ask women, how do they find this? More than 95% of the women have said that they'll do this and they would recommend this to a friend. And 35% of this wouldn't have had a pap smear ever in their lives before. They no longer need to wait long. We've done away with lots of paper registration. Women are now registered using a mobile phone.
For me, when I found out of this ROSE project, I called up every member of parliament I knew. You know, it doesn't matter which party you come from, because we're talking about lives and certain things have to cross the partisan barriers. We cannot waste a second longer. We have to dispense this program nationwide. And if we don't speed things up, lives are at stake.
In Malaysia, fear of examination is known to contribute to low screening and testing rates. This means cancers aren't detected at an early stage when treatment is most effective.
Can you imagine a lot of the women who actually go into the hospitals have late presentation, i.e. stage 3, stage 4, and by that time it's very expensive for them, even for the state, to manage a treatment.
The tumor was with me quite a long time. But I didn't realize because I'm the type which is very scared to go to the hospital to do any pap smear or to check anything. I went and told to my mom. I said to her, Mom, I'm having this kind of things. What should I do? So she bring me to our family clinic. When the report came out, the doctor called me and she said, it is 100%, it's a cancer stage 2B. That is the first day I saw my mother cried for me and she said, my daughter need to be saved. I was working while I was doing the radiation. I went to work because I have to work because my husband is a handicap. So I need to go work for my 2 kids. So I went, I suffered a lot. I have the pains and my legs were cramped while I'm walking. And my work is not a very simple job. I'm a building manager and I need to go up and down for 20 staircases and everything. I need to check what are the problems and everything. I like to bake. So what I did, I bake. I bake and I sell because my salary is not enough for me to pay off for my treatment. What we did, we planned to take a loan, illegal loans, and we take that money. And now it's already a year and I'm still paying a monthly installment for them. But I'm still in a tight situation of them for my financial.
A cancer diagnosis can financially cripple families. We found that after a year of diagnosis, 1 in 2 patients surviving cancer were affected financially, where the family had spent catastrophically. And we define financial catastrophe as a family which has spent more than 30% of its annual household income for cancer-related care. It's not just about making expenditures, but also the sufferings that come along and the sacrifices that people make, and to the extent that it also affects the well-being of the family and young children.
I cannot show my pain and everything to my family. When I show to them, they feel so down.
I believe, with the right approach, the right degree of political will, Malaysia can spearhead this move. We don't just want to eliminate cervical cancer in Malaysia. How about Laos? How about Cambodia? How about places where there's no access to proper clinic, proper doctor, that you have a test kit. The accuracy is very high, and from there, the women can then be treated.
I will be so happy if they eliminate it as soon as possible. I will support Malaysia government 100% for this because I don't want other ladies, other women outside to get the problem as what I had.
Professor Karen Cantill's focus is cervical cancer screening and HPV vaccination. I'm here to learn how these 2 strategies have placed Australia in a leading role in the fight to eliminating cervical cancer.
Australia is on track to be the first country in the world to eliminate cervical cancer, and by that we mean achieving rates so low as it's considered to be controlled as a public health issue. So Australia was the first country in the world to implement a national, free, publicly funded HPV vaccination program in 2007. And then in 2017, Australia transitioned to HPV-based screening, which provides more effective screening for women. But what's important is this demonstration that it can be done, that vaccination can be scaled up very effectively, that it has an impact on precancers and ultimately on invasive cancer.
Certainly cervical cancer elimination is our target, but equity is our goal here. We know that cervical cancer is more prevalent in disadvantaged populations, and that is going to be the focus of our work. And I think in this environment, what better way could there be to be promoting the health of populations than addressing what is entirely preventable? a disease that causes so much harm, and yet we have the opportunity with very cost-effective strategies to change that outcome.
Successful research collaboration can occur when people get on together and they have similar goals. And in terms of the HPV technology, lots of new methods are coming up. And that's where the collaboration comes in, knowledge sharing. They're just a call away and we can discuss problems, ideas, and it gets sorted out.
We absolutely need to prioritize women who might be suffering now that we can intervene on, we can help them, stay or get healthy. But also we have to think bigger. We have to think multi-generational, and we shouldn't think only about putting a Band-Aid on or dabbling in making things better. And that's why I love the concept of elimination. The fact that we have an HPV vaccine, an anti-cancer vaccine, essentially, means that in a generation, we could be in a fundamentally different place than we are right now. Do I think we should be talking elimination every place in the world? Yeah, I do. And the question is, how's the world going to step up to meet that need?
Partnerships appear to be pivotal to achieving the elimination moonshot. A coordinated approach between government, non-government organisations and industry may be the key to achieving this ambitious goal.
From a government perspective, we're looking at policy and programs. From a philanthropy perspective, we're looking at funding along with government, and industry are providing the infrastructure, the training, the education, the know-how, so the technology to do the testing. Not one group can do it on their own. We need to have the three groups doing their different jobs, if you like, to make sure that the program works from all angles. We can use our learnings from the HPV experience and the cervical cancer experience as a blueprint for other disease areas, whether it's breast cancer or colon cancer or other diseases. We've got the learnings from a public health program and the infrastructure in terms of the labs and the skills required in the laboratory.
In places like Australia, we're on the brink of eliminating the disease, but in our nearest neighbours in Papua New Guinea and the Western Pacific, particularly in a lot of the African nations, this disease is still running rampant. And now with new technology, we only have to screen women twice in their lifetime at the age of 35 and 45, and that will tell us whether they've got the HPV infection. At the same visit now, with new technology, we can actually treat women who do have the infection, allowing this to really be deployed in some of the emerging economies and poorer rural areas.
For us to talk about elimination, we're talking about women getting screened, and we're talking about HPV vaccination. Zambia started the HPV vaccination in 2013. Over 50,000 girls got vaccinated from 2013 to about 2016, which was a great milestone for the nation. Over the next 5 years, we must ensure we are having 90% of these girls getting vaccinated, that we ensure that over 70% of these women are getting screened, ensure that women are getting treated. What Zambia has done basically shows that it can be done by any of the low-income countries.
In my experience, the problem is the same everywhere, whether it's being an uninsured woman in Houston or in the Rio Grande Valley or being in El Salvador, Africa. It's just really getting access to all the preventive measures that we know work really well for cervical cancer.
In many African countries, there are other barriers to overcome before women can access healthcare. Some of these are embedded in traditional cultural beliefs.
If a woman sees that they are bleeding, they will think This is probably they have been bewitched. So the first place they are going to go to is the witch doctor, because they are the ones who fix such things, or the herbalist, or the traditional healer. And in all these pathways to treatment, we're losing time. But that is because culturally they've been told when they are having this type of symptom, is because somebody has done this to you.
Unfortunately, all the people that I talked to, all my friends, all they could tell me was, no, Lois, you've been bewitched. And I bought it. So one day I decided to go to my local clinic to access my drugs, my antiretroviral therapy drugs, because I'm also HIV positive.
Lois, like over 13 million women living in sub-Saharan Africa, has contracted HIV.
So what we're finding is there's a link of the co-infection, so HPV, human papillomavirus, and HIV together. And we know that women living with HIV are 4 to 5 times more likely to get cervical cancer than a woman without HIV. So women with HIV do need to know about their cervical cancer risks, do need to know about the opportunity for screening, and do need to know that finding this cancer early can help save their life.
I was very fortunate that when I went to the clinic, the peer educator who was at the clinic was actually talking about cervical cancer. So I was able to see the difference between my cervix on the screen and the normal cervix that the peer educator had shown me. I was sort of scared. Even on myself, I could see that my cervix was not okay. That's when I was told that I had cervical cancer. I must tell you, that was the worst day of my life. To me, it was almost like a death sentence. I lost my mother to leukemia. I lost my dad to liver cancer. I had a sister who died of esophagus cancer. So to me, that word cancer was automatically death. I was very fortunate because the same doctor that's read the results to me told me, no, Lois, you do not have to worry anymore, because here in Zambia, there's now treatment for cancer. You know, one thing I've learned about cancer, when you start treatment, that's when you become even more sick, because the chemo is just an animal on its own. It will just kick you around like mad. I don't even know how to explain it. So it robbed me of all my happiness, all my life. It was just terrible. One will never know when one has acquired the HPV virus that causes cervical cancer. So the best thing is go and have yourself screened so that it's detected and you avoid a lot of pressures that I went through. Who knows? It might save your life.
Thanks so much for coming in to have a chat today. I'm really interested to learn more about the role of radiation and the treatment of cervical cancer.
Radiotherapy is necessary to treat locally advanced cervix cancer. So large tumours or ladies who present with nodes, positive nodes in their pelvis. Radiotherapy is made up of 2 parts. External beam radiation treats from the outside, and then the other half we give via brachytherapy to irradiate the uterus and cervix from inside. Very conformal, sort of shaped field of radiation that doesn't go too far beyond the cervix and uterus, so we don't cause too much toxicity. Absolutely necessary to cure cervical cancer.
It's also really looking at populations as well and being able to treat as many women as possible, and certainly there's a lot of places in these low middle income countries where lack of health services means they do present late. They don't have sufficient imaging services or even pathology services to get an early diagnosis.
So we have to be realistic. What have you got available? How can we show you to use that more effectively?
So it's looking at each setting and trying to tailor solutions unique to what is available in that region.
We are privileged as a nation to have a gynecologic oncologist. We have the first Zambian who is doing that. We also have a US certified gyne oncologist who's helping us. But if we only have 2 people catering for the country, that already is a problem. So there's a bit of lag in ensuring that these women are on treatment and they're getting their radiotherapy, their chemoradiation on time as well.
Radiotherapy is the definitive treatment for the more advanced cervix cancer, and to be able to achieve that is really building up those resources, and without the workforce, all the infrastructure in the world won't help that. So there's a lot of work that needs to be done in that space.
Is radiotherapy and brachytherapy something that can be personalised to each individual woman?
Yes, it is, and that's what the Embrace study showed us, that if we used imaging to totally shape the radiation field to that particular tumour in that particular lady, you can improve outcomes because you're targeting the tumour better. You're also sparing the surrounding organs at risk and reducing toxicity, so she can go on to lead a very fruitful life.
If you had the opportunity to eliminate a cancer, why wouldn't you take that opportunity? Especially with a cancer that is responsible for so much death, disease and suffering worldwide. I think this issue gives us the opportunity to change the narrative about cancer in a number of ways. Firstly, I hope it prioritises prevention. We've seen already with cases such as bowel cancer, with smoking and lung cancer, that prevention delivers really strong public health outcomes, and it often delivers them in a more economically efficient way. I think cervical cancer is a really good example of where partnership is going to be critical to help us achieve our goals, whether it be medical research, behavioural research, the work that is happening in biomedical settings to deliver us the outcomes and the treatments and the detection tools that we need, but also the way that these leaders in research are being so generous with the way that knowledge is being shared globally. And we certainly want to be part of that. We want to be able to use the knowledge that is generated in other countries and apply it locally. We also want to make sure that knowledge that we generate is being shared, particularly in low and middle income countries where the challenges with cervical cancer are greatest.
Good, it looks good. Perfect, thank you.
Early in 2022, I signed an agreement with Dr. Tedros, Director General of the World Health Organization. Our alliance will be a powerful match for the obstacles that stand between us and the attainment of our Sustainable Development Goals. At the forefront of my mind was our battle against cervical cancer. Why? Because despite cervical cancer being a global health issue, women and girls in the Commonwealth are disproportionately affected by it. The Commonwealth is home to 30% of the world's population, but Commonwealth member countries account for 40% of global cervical cancer incidence and 43% of cervical cancer mortality. There is an urgent need to raise awareness of and take comprehensive action on cervical cancer. Most especially, we need action to close the gap, which means many developing countries do not have the same access to medicines and technologies to treat cancers as wealthier countries and nations. But we can take heart and inspiration from the progress we are making. The scientists that have led innovations in treatment and prevention, from screening, diagnostics to the HPV vaccine, are pioneers. It seems that every day there is another remarkable discovery that takes us one step closer to eliminating cervical cancer deaths. But we can only reach that point through greater equity. Everybody needs access to the strategies and treatments which work. That is why the Commonwealth Secretariat has created a price-sharing database which offers maximum transparency pricing on medicines and vaccines. We've also created an international cervical cancer task force to help our member states reach key milestones on cancer. Alongside our tireless and powerful advocacy and our strong partnership with like-minded organisations such as the World Health Organization, I believe that we have the tools we need to win the fight against cervical cancer.
We still have a lot of power dynamics going on in homes. Some women cannot just get up and go and get screened and get treated if we find something. They always have to consult someone in the family, their partner. The gender inequalities must be reduced as much as possible so that a woman can be able to make a decision which is life-saving. Sexual reproductive health in our society is something that we don't discuss openly. It's something that still has kind of shroud in mystery. So we find that they could have seen that there's something going on which is not right, but they can't speak about it openly. They wait until maybe they find a hospital where they can be able to speak about it to something older, or they just keep quiet until it's very late and the disease has advanced. So we have to break the taboos that go with women talking openly about their sexual reproductive health.
You were talking about sexual interactions, and in a Muslim country, that's an absolute no-no. Even when we first started talking about breast cancer, you weren't able to actually say the word breast on TV. So we got a lot of pushbacks for talking about HPV. And the worst pushback, I think, were from women themselves, because women felt stigmatized. It was something which they were more stigmatized about compared to if you were talking about breast cancer. And at the end of the day, you didn't choose the cancer. You had no choice in terms of what cancer you had.
Recently, I have diagnosed with cervical cancer, but currently the cancer have relapsed and it considers stage 3 or 4. Yeah. I mean, before I found out my sickness, I very reluctant to go for the normal, regular pap smear test, because I feel a bit like uncomfortable and I feel a bit shy. When I know that I have this sickness, I just terrified. I just feel afraid. Even recently, my pareidotic have relapsed again, so there will be more treatment on the next 5 months. Now I still with my hair, but soon it will drop, or this sickness can be prevented. If I can turn the clock back to previous, that I haven't had this sickness, I will love to make myself the one who know this at the earlier time. Because at that time, I get the vaccination and get all the pap smear done, I wouldn't get to this journey. Yeah, I will not get what I am and what I have, the sickness today. Yeah. As my husband, he is very supportive and I feel grateful. I also feel that a bit sad. Sometimes when I saw his face and I realized he can't do anything and only can see how suffer I am during the treatment, sometimes we just cuddle together and cry because we don't know what next. Yeah, I just feel that if there is a chance for me, I will keep on fighting. Yeah, I will just keep on fighting. Yeah. Yeah. Yeah.
After a long journey, Chris's cancer is in remission and she is feeling confident about her future. In the time that you've been watching this film, over 30 women will have lost their battle with cervical cancer. But we can prevent the lives of women being cut short unnecessarily. This is the most extraordinary health story of our time. The world is rising up and the tide is turning.
The ability to conquer cancer by seeing the elimination of cervical cancer, it's so powerful. It's amazing.
We have to take this opportunity, we have to take this moment in history to make this something that we achieve.
Because this sickness can be prevented. I don't wish to see any women and girls in this world to have this sickness because this is really suffering. I don't wish them to experience what I have experienced, yeah.
The lessons learned from cervical cancer is how collaboration, how working together actually can make such a huge difference. It's the sound of many voices speaking the same message.
It's faces that come to you, faces of women who came late, who are no longer there, faces of women who came early, and I meet them on the street and they're still alive. That means that something can be done.
Together, we can save the lives of millions of women. So let's dare to dream of a world without cancer because this moonshot is within reach. So you might be wondering, what can I do to help eliminate cervical cancer? Well, there's a lot you can do. All of us can support getting children vaccinated against HPV. Children with an HPV vaccination will be protected against cervical cancer and other HPV-related cancers. We can also support all women to get screened for HPV and cervical cancer. And then support them in getting treatment if and when it's needed. If you're a policymaker, the World Health Organisation's elimination milestones require your country to ensure 90% of girls are fully vaccinated with the HPV vaccine by the age of 15. 70% of women are being screened by the age of 35 and again by the age of 45. And 90% of women identified with cervical disease are receiving treatment. Please help us spread this message. Share this film by hosting an event. Find out more at conqueringcancercampaign.com.
And so with time, we find our place, or at least a moment to look fearlessly at the sky.